So you might be thinking about having eyelid surgery or have just had eyelid surgery, and you're wondering and worrying, what is the worst thing that can happen after eyelid surgery? I'm going to tell you in this video how to take care of your eyes after surgery and what to look out for that worst complication, something called a hematoma. Let's just say you went and had your consult, saw your surgeon, they gave you some instructions, but when you go to the doctor, 80% of the stuff kind of goes in one ear out the other and you forgot what he or she said. This video is going to help you kind of dial down on what's most important after surgery and how to take care of your eyes so that you can be on your guard for what can happen after surgery. If you're new to our channel, my name is Dr. Kian Eftekhari. I'm an oculofacial plastic surgeon who's been in practice for over 10 years and have performed thousands of eyelid surgeries. These are the things that I tell my patients when they come to my office, and hopefully it can help you if you're contemplating or have already had eyelid surgery. If you'd like more content on eyelid surgery, please think about subscribing to our channel so you can learn more. All right, so number one, after surgery, take it easy. Rest and go home. Whether you had surgery under anesthesia or if you had surgery in the office under some oral sedation or even just with local anesthesia, you just want to take it easy after surgery. Get some ice packs on your eyes about 15 minutes out of every hour, just while awake. You don't need to do it overnight or wake up in the middle of the night. That'll help to get some cooling areas on the eyes to prevent bruising. The other option is something called lid lift goggles, which hold compression on the eyes. If you got lid lift goggles, you want to wear those for 3 hours after surgery continuously, and then about 80% of the time for the first 3 days after surgery. Those are the things you want to do in terms of taking care of pressure on the eyes. Just take it easy. You don't want to do anything that's going to get the heart rate or the blood pressure up, because that can increase the chance of having a hematoma, which we're going to talk about. Second thing is you're going to want to use some artificial teardrops. I like the preservative-free kind that come in the individual blister packs, because your eyes are going to feel kind of gritty, sandy, scratchy, or irritated, sometimes even watery, which is a sign of dryness of the eyes right after surgery. And those synthetic tears are going to be a little bit better quality than the tears that your body is making right after surgery. You're also going to want to use some antibiotic ointment on your stitches, around the eyes, or even inside the eyes as you go to sleep at night. If you want some tips on how to apply the eye drops or the ointment, check out our video specifically on that, where we'll give you some tools for that. Lastly, what is the worst thing that can happen? What do you want to be thinking, okay, if this happens, I need to call my surgeon right away? So the answer to that is bleeding behind the eye, or something called a hematoma. This is super rare. It is about 1 in every, let's say, 2,500 to 20,000 surgeries. We don't even have very good data on it to give an exact number. It's extremely, extremely uncommon, but it's important to know what to look out for. So if you were to have a hematoma behind the eye, an accumulation of blood in a tight space, that could potentially cause permanent vision loss. The signs of that are going to be significant swelling around the eye, to the point where you can't even pry your eyelids open. Everybody gets swollen after eyelid surgery. It's going to feel hard to open your eyes, but if you can voluntarily open your eyes, pretty much you don't have a hematoma, most likely. If you try to pry your eyelids open and the other one's opening just fine, but you just can't open this one, and it's accompanied by significant pain or even nausea and vomiting, those are the things you want to consider calling your surgeon right away, because that could be the sign of hematoma. So again, significant swelling to where you can't pry your eyes open, significant pain behind the eye, potentially loss of vision. If you can get a little glimpse out of there and you don't really see anything, or it's black, that's an emergency. You want to call your surgeon right away. The reason you want to call them right away is because there might be a way to reverse some of the changes that are occurring around your eye if you get to it emergently. So not to scare anyone away from eyelid surgery, but it's important to know how to take care of your eyes after surgery and what you need to be thinking about as far as what's the worst thing that can happen that I need to be calling my surgeon for as you recover from eyelid surgery. If you like this video and want to get more information on eyelid surgery, feel free to check out other videos on our channel or our website, eyelidcenterofutah.com. And I hope this was helpful to anyone who's considering eyelid surgery.